a 32-year-old female presents with red, painful nodules on her shins and bilateral ankle swelling. I am showing you her posteroanterior chest radiograph and an axial high-resolution chest computed tomography scan. Describe the findings.
The chest radiograph demonstrates bilateral symmetric hilar lymph node enlargement, along with right paratracheal lymphadenopathy, representing the classic Garland triad, or 1-2-3 sign. There's also a mild, diffuse reticulonodular pattern in the upper and middle lung zones. The axial computed tomography scan confirms symmetric enlargement of the hilar, subcarinal, and right paratracheal lymph nodes. It also demonstrates numerous tiny pulmonary nodules measuring 2 millimeters, showing a classic paralymphatic distribution along the bronchovascular bundles, interlobular septa, and subpleural surfaces, particularly along the major fissures. These findings indicate thoracic sarcoidosis, stage 2. The clinical presentation of erythema nodosum, polyarthritis, and bilateral hilar adenopathy is highly characteristic of Löfgren syndrome.
What percentage of patients with sarcoidosis are asymptomatic at initial presentation? And are non-casating granulomas pathognomonic for this disease?
Approximately 50% of patients with sarcoidosis are completely asymptomatic at initial presentation, with the disease discovered incidentally on chest radiographs. Widespread non-casating epithelioid granulomas are the pathologic hallmark of sarcoidosis, but they are not pathognomonic or specific. They can also be seen in fungal infections, tuberculosis, hypersensitivity pneumonitis, and borreliosis. Therefore, a definitive diagnosis requires a consistent clinico-radiological picture, histological proof, and the strict exclusion of other granulomatous infections.
Describe the scanning radiographic staging system for sarcoidosis and outline the clinical management, including a critical safety precaution prior to treatment initiation.
The scanning system stages sarcoidosis on chest radiographs as follows. Stage 0 is a normal radiograph. Stage 1 is hilar lymphadenopathy alone. Stage 2 is hilar adenopathy plus parenchymal opacities. Stage 3 is parenchymal opacities alone. And stage 4 represents end-stage pulmonary fibrosis. Asymptomatic patients with stage 1 disease usually require no treatment and can be observed, as the majority resolve spontaneously. For symptomatic pulmonary disease or extrapulmonary organ involvement, systemic corticosteroids are the first-line treatment. Crucially, before initiating corticosteroid therapy, we must absolutely exclude tuberculosis and fungal infections using special histological stains and cultures to prevent life-threatening disseminated infection. I would recommend referring the patient to respiratory medicine and ophthalmology for screening.